just because we can track more doesn't mean we should unless it's easy on the patient. I'm a site owner. I see the amount of diaries we ask our patients to do at home, and it's pretty burdensome. And yeah, the more data we can get, the better for society. But what about that patient? That patient signed up to do a trial to figure out if something's working for themselves and maybe get some answers for themselves. They didn't necessarily sign up to generate data for the entire industry. And I think there's a balance between what we are asking of patients to do versus what the industry is capable of. I remember, and I'm glad this was shut down, but about a decade ago, or maybe more now, to ensure patients were compliant with their investigational product, they would put like RFID trackers in the pills. And yeah, just because the technology's there, that's good data. We would know for sure patients are compliant or not. People were not, and understandably so, not okay with being tracked all the time, and not okay with swallowing pills with RFID chips in them. And so that idea was shut down. Like, just because you can do something doesn't mean you should. And this gets back to ethics and what is good for that individual, maybe, or what is a burden on one is a benefit to the rest. But then you're not going to have, if you make it too burdensome for the patient to participate in a trial, you're not going to have participation. And it all boils down to the human being. So all these technologies we use, it boils down to patients being willing to do it. This is patient centricity after all. Coordinators being able to do it and not burdening the coordinators. So now this is site centricity.